Thanks to a very effective vaccine, cervical cancer is a disease that is easy to prevent. Here's Denver 7's Katie LaSalle.
Dr. Jeff James, Colorado gynecologic oncologist, joins us now. And Dr. James, thank you for being here. Can you start with just some basics? What is cervical cancer and how common is it?
Yeah, my pleasure. Thank you so much for having me, and thank you guys for doing this. So cervical cancer is a cancer at the cervix, which is at the top part of the vagina, the lower part of the uterus. It's not very common in the United States. There's about 14,000 women who are diagnosed with this a year here. It's much more common worldwide, and particularly in developing countries, it's much more common. The reason why the disparity is we certainly have pap smears and the ability to have screening here in the United States that they don't have access to necessarily in developing countries. So it's not particularly common, but it is important because it's something that we can continue to reduce the incidence of and hopefully potentially get a cure to.
And can this be prevented? Can you tell us more about the HPV vaccine?
Yes, absolutely. So at this point, we do have a vaccine. It's called the Gardasil vaccine. It's, originally we had, there's over 100 different types of HPV, or the human papillomavirus, which attributes to 99.7% of cervical cancers. So the vaccine was originally a 2-strain vaccine. We know of about 11 strains currently that can cause precancer or cancer. And then we eventually developed a 4-strain. The current Gardasil vaccine, which is the only vaccine available in the United States, covers 9 of the strains, which is by far the most common precancer and cancer-causing strains. It's recommended to get between the ages of 11 and 12. You can get it as early as the age of 9. It used to be given up till the age of 26. That's been expanded to up to the age of 45 currently. So certainly it's very effective. It's particularly effective if you get it before first intercourse. So we certainly recommend that for sure.
And besides the vaccine, are there preventative measures that can be taken for women?
Absolutely. Smoking is a big risk factor for cervical cancer. So smoking cessation or not smoking is of course very helpful. Condom or barrier protection use, limiting number of sexual partners are all helpful in preventing transmission and acquiring cervical cancer.
And you mentioned it's not super common here in the United States, but knowing that all women are at risk for cervical cancer, are there signs and symptoms to look for?
Yes, absolutely. So heavy periods or bleeding in between periods, particularly postcoital or after intercourse bleeding are all some of the more common signs. Sometimes mucousy discharge or watery discharge that's persistent or consistent would also be some signs that would need to be evaluated.
And I imagine regular checkups are important for women too?
100%, absolutely. We full support of seeing your primary care or OBGYN doctor for annual exams or visits. And the guidelines on those are constantly changing, so checking in with your primary care doctors is always a great idea.
Dr. James, thank you so much for your expertise and your time today.
Thank you so much. Appreciate it. Thank you.
And along with our partners at the Colorado Cancer Coalition, the American Cancer Society, the Sarah Cannon Cancer Institute at Health One, and the Cancer Support Community, we've put some resources on the Your Health Matters page of thedenverchannel.com.